Just being in surgery is really awesome. It's not something people get to see every day.
It's a really interesting kind of pathway to get to find us. But once you do, you're kind of addicted.
We are going to be doing life-changing things.
Surgical technology is not a very well-known field. We work in the operating room for healthcare facilities, big hospitals, day surgery centers, endoscopy centers. And most of our patients are medicated before they ever get to us. So if you don't already know someone who's a surgical technologist, you may not even know that this is a possibility for you.
Someone who wants to do something different and be good at a lot of different things, who wants to have an adrenaline rush every now and then, someone who can get along with a lot of good, different personalities. When I was young, I wanted to do something in the medical field, but I didn't want to go to school for years and years and have student debt.
We've had students where this is their second, third, fourth career. Students have prior military backgrounds. We've had students that are in the dual credit program. If you are a hard worker, if you like to think fast on your feet, you have a servant heart and want to take care of people, sometimes in their darkest hour, we totally prepare you to be able to take excellent care of a patient in the operating room.
This is our classroom. So we will teach a procedure using our mannequin and our setups. Our program teaches a lot of skills that a surgical technologist is going to need, from a basic hand wash, putting on gloves, learning a basic setup of instrumentation, including supplies, how to perform our counts.
I have 1, 2. Hypos, I have 1. Suture needles, I have 1.
Leaving a sponge in can cause severe damage, sepsis, infection, things of that nature. You could leave needles in and that could puncture something like a vessel, cause internal bleeding. There's a lot of different things that can happen if your counts are wrong.
We understand that our students, many of them are non-traditional, so they do have to balance family and a career and bills and the workload of getting an education. So we've tailored an approach that allows them to be able to do all of that and still get a really world-class education.
When I pass the scalpel, why does the blade need to be facing downward? We have to make sure that we can effectively communicate with each other because there's so much commotion going on. The anesthesiologist telling the doctor what's going on with the patient. You have someone telling you vitals, and there's always chatter in the operating room. That is why it is extremely crucial for you to always be on your toes.
Minimally invasive surgery is the main approach to a lot of procedures that we do on our patients. And so the surgeon needs both hands in order to be able to operate. And so who's driving the camera? That's us.
There's a lot of benefits to being able to use scopes and instruments through small incisions. It's a lot less traumatic for the patients, the recovery is a lot faster. When you're taking part in a surgery and you don't even have to think about what you're grabbing, and it's just muscle memory, and then you notice that everything around you is just flowing. It's an incredible feeling. That's how I kind of knew that I loved what I did, and I was good at it.
Students must be a certified surgical technologist in order to work in the hospitals. And we can't do that without our clinical partners.
Once the students get to clinicals, they do have hands-on with a lot of patients, standing right next to the surgeon with their preceptors and the nurse in the room.
The surgical technologist and the surgeon become one. And then you also have your assistant, all three of you will become one. And the circulators, which are the RNs that are in the room with you, they also will come in when you need help. If you happen to drop an instrument or you need more sponges, they will be there to get those for you because you can't leave where you're at.
Sometimes the surgeons will even say, "What do you think I should use right here?" And you're like, "I guess this could maybe work." And sometimes they take it, sometimes they don't. But also just knowing that they rely on me to keep everything sterile and they trust you, it's all on you at that point.
We get to help people walk again, we get to give people their livelihoods back, improve their health, all while prioritizing their safety. Is a really rewarding feeling.